Hi everyone, and welcome to this course on how to help your baby with infant dyschezia. A quick but vital disclaimer before we begin. I am not a medical doctor, I'm not a nurse or a midwife. I'm a doula and a newborn parenting coach. I help people with basic baby care, not serious medical conditions. If at any point you suspect that your baby needs medical attention, please don't wait to hear what some stranger on the internet advises you to do. Just take them to a physician immediately. The techniques I'm going to show you are used safely by billions of parents all around the world, but that doesn't mean that they're always right for every baby. If you do anything with a baby and they respond by screaming, or they resist you with their muscles, or they seem to be in pain, stop immediately and get them checked out by a medical professional. Make sure to double check their hips, their spine, their abdominal organs. If something is wrong, your baby will tell you and you must trust them. Having said that, let's get started. So what is infant dyschezia? Well, here is what I could find on the internet about this mysterious and rather distressing phenomenon. Infant dyschezia is a functional gastrointestinal disorder characterized by at least 10 minutes of straining and crying before successful or unsuccessful passage of soft stools in an otherwise healthy infant less than 6 months of age. So it's in babies less than 6 months of age, and it's not constipation with hard little stools. It is a combination of chronic and recurrent symptoms that does not depend on the anatomical, inflammatory, or biohumoral anomalies of the bowel. Infant dyschezia is also known as grunting baby syndrome and is a muscle coordination problem where the baby is having trouble coordinating the different muscle groups necessary to poop. Statistical data on the prevalence and natural history of infant dyschezia are not well reported in the literature. There's no specific treatment for this disorder, says the internet, but it is important to reassure parents about the functional nature of the problem and the benign evolution over the months. Now, I'm going to put the first spoiler alert out there. I think this diagnosis leaves much to be desired. Living in a third world country like I do, raising my baby here with natural methods of infant hygiene, I found this entire concept to be something only a first world person who had never encountered a diaper-free baby before could possibly come up with. What is thought to be the cause of infant dyschezia? Newborns have a reflex called the gastrocolic reflex. It's a wave-like movement of the muscular walls of the large intestine in response to food entering the stomach. So basically a way for the body to make room for new food by clearing out the waste in the lower part of the colon. So I've seen several doctors and baby care consultants online claiming that somewhere between 4 and 6 weeks of age is when the gastrocolic reflex goes away, and that this is what causes babies to struggle with bowel movements in a way that they didn't do before, and that now the baby needs to learn how to have a bowel movement voluntarily, and that some babies struggle to coordinate the muscle groups which help this to happen. And while this theory sounds great, it just simply isn't factually correct. And in the next video, I'm going to tell you what Google told me about the term gastrocolic reflex.